Sir, the last case for TKR is postponed, sir. Postponed? But for what reason? Sir, actually, the patient had positive pus cells in the urine RM, sir. That is why. Why do you want to postpone a elective case for that? No, no, sir. Not only urine RM. The patient has Acinetobacter positive in the urine culture. So, sir, the patient had to have some antibiotic, right? Wait. Your patient had incidental growth in your urine culture. Does the patient have any symptoms associated with it? No, sir. The patient doesn't have any symptom. Okay, wait a second. So the patient doesn't have any symptom. That is a asymptomatic bacteriuria with incidental growth positivity in that urine culture, right? Yes, sir. Exactly. That sir, even orthopedician has said that his TKR wound will get infected if he is operating on such a growth positive culture. Let's clear the anesthesia part first. Nobody of anesthesia like ISA or ASA says that asymptomatic bacteriuria is a contraindication for an elective surgery, non-urological surgery. Similarly, the infectious guidelines 2019 strongly suggests that if the patient is asymptomatic, you do not require a urinary screening for checking the pus cells or culture sensitivity to be done. They strongly recommends against it, and even if you have done a screening test for the same, you don't have to treat a asymptomatic bacteriuria. Yes, you can take the patient for the elective TKR surgery even if he has incidental growth culture positivity in the urine because the patient is asymptomatic. You don't have to do anything. Okay, sir. So no patient of asymptomatic bacteriuria should be treated, right? There are only two indications where asymptomatic bacteriuria has to be treated. One is pregnancy, and second is a urological surgery where mucosal damage of the ureter or a bladder has to be done, because that time the culture positive bacteria may actually go into the bloodstream. For a non-urological surgery like TKR or arthroscopies, you do not have to do it. But sir, what if surgeon says that in the post-op period the infection is because the patient was not treated earlier for the UTI? Without asking his permission, you cannot take the patient for the surgery. But organism which was isolated was different from the organism which was isolated from the UTI. That means there is no correlation between asymptomatic bacteriuria growth in the culture and the organism which is actually responsible for the wound infection. If you are also following the same trend that an asymptomatic bacteriuria patient with a growth culture positive report was treated with antibiotics unnecessarily, kindly change the practice. If you cannot follow the institutional guidelines, but remember the evidence, remember that things will change in future very soon. Thank you.